Hey there. Today we'll talk about natural family planning, a method that lets you take control of your reproductive journey. Whether you are aiming to plan or prevent pregnancy, it's important to grasp the ins and outs. So hit that like button, subscribe, and let's unfold the simplicity behind natural family planning. Natural family planning involves using awareness of fertility to either avoid or plan for pregnancy. Unlike other methods, it can be used for both purposes. When used to prevent pregnancy, it has about 25% chance of not working. When talking to people about natural family planning, it's important to understand why they choose it and to give them enough time to understand how it works. Natural family planning is based on understanding the menstrual cycle and fertility patterns. Hormonal changes around ovulation cause noticeable physical signs. The egg is viable for about 12 to 24 hours after ovulation, while sperm can survive for 3 to 5 days. Together, this helps couples identify the fertile period, usually spanning 5 days before ovulation to 24 hours after. When using natural family planning to avoid pregnancy, it's important to avoid intercourse during this fertile time or use other contraceptives like condoms. After ovulation, the corpus luteum releases progesterone, which raises body temperature. By tracking this temperature increase using an oral thermometer each morning, a person can detect a sustained raise of around zero point 0.5 degrees Fahrenheit, indicating ovulation. So, identifying this day, usually around day 14 in a 28-day cycle, helps plan or avoid pregnancy in the future. For accuracy, it's crucial to measure temperature before doing anything in the morning, like using the restroom, eating, or drinking. The hormonal changes in the menstrual cycle affect cervical secretions. Before ovulation, the developing follicle releases estradiol, creating cervical mucus that helps sperm mature and move uh, through the cervix. This mucus, known as egg white mucus, is clear, wet, abundant, and stretchy. It shows up about 3 to 4 days before ovulation and lasts until just after. After ovulation, progesterone from the corpus luteum causes changes in cervical secretions, making them less friendly to sperm movement and maturation. Before ovulation, estrogen goes up, increasing sodium chloride in mucus, seen in both cervical secretions and saliva under a microscope uh, through a pattern called fanning. Estrogen also alters the cervix during fertility, making it more open, soft, high, and straight. There are several methods of natural family planning. The first one is the standard days method. Is a calendar approach to natural family planning. It relies on the likelihood of pregnancy relative to ovulation, usually occurring around mid-cycle. To use this method, avoid unprotected intercourse from days 8 to 19 of the menstrual cycle. It's easy to learn and requires fewer days of alternative contraception or abstinence. This method works best for women with cycles lasting 26 to 32 days. In one study, the typical user had a pregnancy rate of around 12 per 100 women per year, but with correct use, it dropped to less than 5 per 100 women per year. Now let us go to the Billings and Creighton methods involved observing cervical secretions. Billings, the older method, focuses on recognizing changes in secretions. Creighton, a newer approach, requires women to assess secretions using a detailed scale. Checking secretions multiple times a day, like before urinating, is crucial. Use fingers or tissue to collect them. To prevent pregnancy, avoid intercourse during menstruation on specific pre-ovulatory days, after intercourse, on days with ovulation like secretions, and until 4 days after the last day of wet ovulatory secretions. It's advised to attend multiple classes for proper learning and interpretation of secretions. Now there is the 2-day method, which relies on observing cervical secretions, much like the Billings and Creighton methods. The key difference is that it focuses solely on the presence or absence of secretions to identify the fertile period. To prevent pregnancy, it suggests avoiding unprotected intercourse every day with secretions and the first day after. In a study, correct use of 3.5 per 100 women per year, while typical use led to less than 14 per 100 women per year. The symptothermal method combines observing changes in cervical secretions with monitoring basal body temperature. Transparent, slippery mucus signals the start of the fertile period, while an increase in temperature marks its end. Patients need to check secretions, take morning temperatures, and assess cervix position and feel. To prevent pregnancy, avoid unprotected intercourse on days with secretions, pre-ovulatory days after intercourse, and until 3 days of higher temperatures follow 6 days of lower temperatures, or 4 days after the last wet secretions, whichever is later. The market model combines tracking cervical secretions with an electronic device that measures estrogen and luteinizing hormone levels in urine. Rising estrogen signals approaching ovulation, while an luteinizing hormone surge triggers ovulation. The device helps users identify their fertile windows. Other devices like miniature microscopes or handheld tools can also indicate fertility. Some check for fanning in saliva or cervical mucus, while others measure cycle length and correlate cycle day with basal body temperatures. Now let us talk about lactation amenorrhea, which is a method that prevents pregnancy by relying on the absence of ovulation in the postpartum period under specific conditions. It's effective for the first 6 months after delivery if a woman exclusively breastfeeds, feeds every 4 hours during the day and every 6 hours at night, and hasn't resumed menstruation. This method can be up to 92 to 100% effective. Due to the complexity of natural family planning, some individuals might be better suited for alternative methods. For example, those who can't reliably identify ovulation based on the menstrual cycle or cervical mucus may not be ideal candidates. This includes women with irregular periods, like in polycystic ovarian syndrome, younger girls, perimenopausal or postpartum women breastfeeding, or those with abnormal uterine or cervical bleeding. Patients with undiagnosed abnormal bleeding should be evaluated before relying on natural family planning. Some individuals may face challenges like the cost of fertility tracking devices, time constraints for classes, or finding monitoring tasks burdensome. Lastly, couples may find it challenging to avoid unprotected intercourse during fertile times. Success with natural family planning requires highly motivated individuals and couples. Some people choose natural family planning for reasons like religious beliefs or concerns about side effects from other contraceptives. Knowing the menstrual cycle and hormonal changes can benefit both those trying to conceive and those trying to avoid pregnancy. Education is crucial, but some doctors don't talk about natural family planning with their patients. For people to make informed decisions, doctors need to provide enough information about different options. Without a thorough discussion, true informed consent isn't possible. Using natural family planning methods often involves thorough patient education, which can be time consuming. A coordinated team approach involves pharmacists, physicians, and trained educators can be beneficial. For instance, a pharmacist dispensing contraceptive pills or a doctor during a routine visit might identify patients interested in natural family planning. Then a trained educator like a physician or nurse practitioner can provide detailed teaching. Being aware of all family planning methods, include natural ones, allows healthcare providers to offer patient-centered and personalized options. As we wrap up our chat on natural family planning, remember it's all about understanding your body and fertility. Take the time to grasp the ins and outs, and if you are considering it, discuss with your partner and healthcare provider. If this info was helpful, give me a thumbs up, share with those who might need it, and make sure to subscribe for more healthcare discussions. Until next time, take care.